Hi, my name is Daniela Maldonado, and I'm going to talk about a novel familial cardiac arrhythmia syndrome with widespread ST segment depression. Definition: the novel familial cardiac arrhythmia syndrome with widespread ST segment depression was described by H. Bungard in 2018. It's characterized by widespread concave upward ST segment depression, and this syndrome is associated with atrial fibrillation and sudden cardiac death due to ventricular tachycardia and ventricular fibrillation. Autosomal dominant pattern is identified.
I grew up doing a lot of backpacking and hiking with my dad growing up, and then he and I started climbing mountains together in my early 20s. My dad passed away a couple of years ago, and shortly after, I started having a lot of PVCs, like a strange heart arrhythmia, which was initially diagnosed as like a stress-related condition due to all the grief and trauma of the experience I had been through. I ended up feeling really just terrible most of the time, very fatigued and lightheaded and dizzy. But it continued to increase and get worse, so then I was referred to Dr. Dan DeMoody. And at that point, he did not think they were related to stress at all. It was just an electrical misfiring with the cells in my heart. So early April, I had the heart ablation surgery. And then 4 weeks later, I did my trail half marathon. And about 2 weeks later, I climbed Mount St. Helens. About 3 weeks after that, I climbed Mount Baker. And about 3 weeks after that, I climbed Mount Rainier. It was wonderful to be able to run and not have my heart to be doing anything strange and to feel really good. It was probably the best I'd felt on a run in a long time.
Now, with applications in medicine, we have the DTU supercomputer, the computer run applications in medicine, and its function is to map the genes of a patient, which can be determined if the person is predisposed to develop newly discovered heart disease.
Occasionally, a patient may exhibit signs of an inherited arrhythmia syndrome that may be resulting in syncope or passing out spells, either in that patient or in the patient's family members. Where we get concerned about this is if somebody has a family history of either passing out spells, sudden death, or unexplained deaths, things like single vehicle car accidents, drownings or falling off a ladder or roof or things like that that aren't otherwise explained by other events, that may be a red flag in the patient's family history. If that patient additionally has a personal history of syncope or passing out, or either electrocardiographic or echocardiographic findings that might suggest a predisposition towards a specific syndrome, we may have to discuss what that means for that patient and what that means in terms of us having to deliver additional therapies.
Now, with the pros and cons, in the pros we have that it is common for family members with abnormal ECG to experience severe heart rhythms disorders, and some of them develop a reduced pumping function of the heart, and in some cases the disease has caused sudden death. And in the cons, we have that it's a systematic discovery of this new genetic heart disease, recently discovered by a very unusual pattern on the electrocardiogram of a man who survived cardiac arrest. The use of bioinformatics for the study of genetic mapping and discovery of new mutations related to this new cardiac condition. Now with the issues applied in Ecuador, we have that cardiovascular diseases are the first cause of death in the country, and the cardiac arrhythmias caused around 168 deaths only in 2016.
Arrhythmias are conditions where the rhythm is abnormal in your heart. So the brain sends a signal to the heart, and then the heart sends a signal down to the rest of the muscle, telling it how fast it needs to go. So an arrhythmia being one where that is abnormal. So the signs of arrhythmias are lifestyle changes, things that don't feel right. If you don't walk as far as you can, if you can't get out of bed because you're so exhausted, you feel like you're getting a cold, and along those lines, your blood pressure is off, your heart rate's either too fast or too slow. These are all signs of arrhythmias. And the things that lead to them are many. They can be innate, things that you didn't do anything to cause them. Other things can be things you've done, i.e. medications for blood pressure were wrong. Maybe you took 2 of the wrong medicine. Maybe you forgot to take some medications. Maybe you went into an arrhythmia just because you had too much stress, recently was dehydrated, or you had an illness. So a lot of triggers for that, but the symptoms can be many. But usually there is a dramatic change in what you can do or what you call normal.
In conclusion, we have that H. Bungard has presumably identified a novel familial cardiac syndrome, and the diagnosis of this syndrome is based on ECG, family history, and clinical presentation. Given the prevalence of atrial and ventricular arrhythmias and sudden cardiac arrest, this syndrome appears to be very serious, and that's why we need to know the causes of the physiopathology of cardiac arrest.
Genetic factors are important in all aspects of medicine. Heart rhythm problems are one of those. In the heart, we worry most about genes that either cause one of 2 problems. They either cause a heart rhythm problem directly, maybe a life-threatening one, and the other are genes that cause a heart disease that someone would not have otherwise encountered, which, as a consequence of the heart disease, could lead to serious rhythm problems. And so one of the important issues that we deal with in genetics in the heart is to identify those patients who have genetic conditions and treat them appropriately so that complications don't occur. The most common genetic conditions that we commonly encounter in patients with heart rhythm problems are something called the long QT syndrome, which is a condition where the electrocardiogram looks strange, but more importantly, the heart is prone to very rapid rhythms that can cause fainting and recovery from fainting if the rhythms get better, but occasionally can cause a fainting spell that doesn't end, a rapid rhythm that keeps going and will not end until rescued by an ambulance. And that condition is cardiac arrest. And at Froedtert in the medical college, we have genetic counselors who work closely with our clinic to assist us not just in diagnosing these conditions, but in performing the important family screening and treatment that's important to make sure that loved ones also are safe.